Kurambuka pod wan mane kaunti no ma Siaya, sirikand kaunti ma Siaya chano mar nyiewo baraf manyasani mondo mi okony ute thieth mag level 4 rito maber ringre jogo ma otho. Kanolose kinde manolimo od thieth mar Bondo, Gavana ma Siaya James Orengo wacho ni gidwa kelo yore manyasani mag rito ringre mondo mi okonye keto ler e ute mag thieth. Orengo bende nokawo thuolo no mar singo ne jopiny ni obiro neno ni ute thieth duto kaunti no ni kod yedhe moromo. Notene kod jaod bura ma Bondo, video no chanda kod jatend od thieth ma Bondo Michael Oduor.
I believe there are areas that we may not be doing very well as a facility, and some of those challenges we have mentioned one or two, and we welcome the new administration to even steer us further in terms of service delivery in the hospital.
There's been a problem of water. There's a major problem of facilities in terms of the actual physical facilities. What we have here are more very temporary prefabs. A lot of it that were brought in because of the COVID. But I want to believe as you come in, this is a facility that kind of takes care of the entire region, the entire southern part of Siaya, both Bondo and Rieda sub-counties. We want to wish you well, and we want to believe that this is going to be a good beginning, and our communities are going to benefit in a proper manner in terms of health.
I've been told we only have 4 doctors. I think this facility will do better with about 15 doctors, seriously speaking. And also, as Dr. Chanda has said, in terms of facilities, we're grateful that there's an oxygen plant here. We're grateful there are equipment in the Department of Radiology and so on. But the bottom line is that we have to do better to provide a better working environment for the staff who work here, and also to be able to provide better services to the people and the patients who come here.